head. I pledge to my constituents to be their persistent champion, and what I lack in height, I will make up in voice. Thank you very much.
Jackie Doyle-Price.
Madam Deputy Speaker, and what a pleasure it is to follow the Honourable Lady in her maiden speech. She has just proved that what she lacks in height she makes up for in a very energetic performance, and I have no doubt that she'll be giving the Treasury Branch considerable challenge from her position in future. And so many firsts, Madam Deputy Speaker, but I must congratulate her specifically on being the first refugee Member of Parliament. Doesn't it show that in this country we are open and liberal, and we do welcome those from all parts of the world, whatever their circumstances, who want to make a contribution and do the right thing? Congratulations to you. One of the things I do when I go around schools, I give the message to everyone that if you work hard and take advantage of every opportunity that comes to you, you will get on in life. And I now have a new poster girl, so I look forward to hearing more contributions from the Honourable Lady. I'm struck again with the opening speeches that we had. It's getting a bit boring, isn't it? That all we hear about is, we're spending this much money. Well, it's not enough. We could spend more than you. This does not get the best for our NHS. The truth of the matter is that if you sit on this side of the House or that side of the House, we all want our NHS to be the best it can be. And every government of whatever colour will always make the NHS a priority for when it comes to budget time. So let's not make this debate all about money, because when we do, we are letting those areas where we're not doing as well as we should off the hook. Because getting the best out of the NHS isn't just about money, it's about leadership. It's about behaviour, and that behaviour not just on the part of medical professionals, but of patients too. We need to be making sure we're having honest discussions about outcomes, about what we need to get better, and about what we expect from everyone and what patients can legitimately expect from their NHS. And really, this is very much the part of the discussion during the general election. And I can remember knocking on doors and being asked, but can we trust you on the NHS? And I'd say to my constituents, do you know what? Conservatives aren't aliens from the planet Zog who never get ill. We depend on the National Health Service as much as anyone else. Why would we ever engage in an act of self-harm by not doing our best for it? So we can absolutely be clear that under this government, the NHS will have the investment that the country can best afford, and we will focus on making sure it delivers the best service we can. I think when it comes to the biggest challenge facing the NHS, as I say, it isn't money. Workforce does, however, remain a considerable challenge. And while ever we carry on talking about inputs and the need for more doctors and more nurses, we're just going to feed very perverse behaviours and make the labour market within the NHS dysfunctional. Medical staff know they can earn more as locums, so we have a massive vacancy rate and the salary bills skyrocketing because people are making those choices. So we need to do more to address that. But I'd also say there's a lot of healthcare that can be delivered not by medical professionals. And we need to look at where the NHS can look at commissioning services from the voluntary sector where things can work. It's not just about doctors and nurses, it's about a more holistic approach to well-being. And I would really welcome if we could move our political debate on away from pounds and towards patients. Just a few brief points about where I'd like to see much more attention. My right honourable friend, the member for South West Surrey, has spoke very passionately about patient safety. And again, I think that's where we really have to focus on the outcomes. And no one did more than he to give that challenge. And I'm very pleased to represent a constituency that at the time he became Secretary of State, we had a failing hospital, but thanks to the measures he put in to improve performance, we now have a hospital that is giving the service that we deserve. And we should not be shy about challenging where there is poor performance, because you will find that those excellent doctors and nurses and people delivering medical services, they know when things are failing and they would welcome the challenge to the leadership of their institutions to make it better. But I think we really need to do more to help those more vulnerable patients. I often say that the public services do very well for the pointy elbow middle classes who are able to fight for what they want. But the test of how good a society is how we treat the most vulnerable. And in that regard, I really welcome the commitment to reform the Mental Health Act. You know, the Mental Health Act is a product of an era where, you know, people with mental ill health were an inconvenience to be managed. I'm pleased to say we've moved on very far from that, and that we will have reforms which will empower patients to look after their own recovery. And I know we should be very grateful to those people who've been through detention, who shared their very distressing experiences to make this better. I can see, Madam Deputy Speaker, you're looking at the clock, quite rightly. But I just have one final challenge where I think certainly I, as a Minister, was very disappointed that I wasn't able to do more, and that is the whole issue of people being detained with autism and learning disabilities in institutions which, frankly, are doing them harm. And I was horrified to see a report on Sky News just this week which showed that we've lost 10 people in the last year in those institutions. This is a mark of failure of the state, where families entrust the trust of their loved ones to that care and then they lose them. So I hope very much that we will redouble our efforts to make sure that we are not putting people into inappropriate care settings, and we are actually giving them the tools to be able to live outside of those institutions.